with some of the members of the congressional delegation. I came up here to update them on the issue we're having with HHS, that they're ending the low-income pool. First off, it's hard to believe the Obama administration wants to end a program for low-income families, but they do. I have to update them on the fact that the HHS is coercing us. They sent us a letter linking the continuation of the low-income pool to expansion of Obamacare. This is clearly a violation of NFIB versus Sebelius. So we have sued the federal government. I'm very appreciative of Texas and Kansas because they've done amicus briefs to support us. So I'm up here asking for our congressional delegation support. Also met with the chair of the House Energy and Commerce Committee, and Chairman Upton is going to hold hearings this summer to review this coercion. It says governor of a state is frustrating the feds will start a program and then walk away from it, and then try to coerce us to expand. This is clearly a states' rights issue versus federal overreach, and it's hard to believe the same administration that was told that they couldn't do this in NFIB versus Sebelius is doing it again. I'll be glad to answer any questions.
Governor, the state of Florida has a surplus. Why not use that and avoid a continuation? And secondly, how can you do a continuation budget and not do Amendment 1, which the voters approved?
First off, if you go talk to families in Florida, what would they like? They'd like a job. We've added 841,000 jobs. They'd like a better education system all the time. So we have, in my budget, we increased the funding for K-12 education while we have the highest funding in the history of the state. This year in my budget, I propose the highest per pupil funding in the history of our state. That's important to our families. Also, as we've seen our jobs come back and our revenues go up, we should continue to reduce taxes if we're going to continue to get more jobs. I propose $670 million worth of reduction in taxes for our citizens. We've already done it 40 times in the last 4 years. We need to continue to do it. It's a fair thing to our citizens. This is a federal program. The federal program that the federal government started, they should continue their program, and they should not be coercing us to pick up another federal program that's not working.
Excuse me, but you didn't answer those questions, sir.
On your sharing plan?
Say again.
Do you expect to get a favorable response from the hospitals on your sharing plan?
Well, we'll see what HHS is going to do. Right now, what I'm focused on is the SLIP funding and the coercion by the federal government and the help of my delegation.
Governor, what can Congress really do about it, though? I mean, you said Chairman Upton was going to have hearings, but what can they do to help you with your low-income pool money?
I think what they can do is they can continue to highlight what the federal government's doing, what the Obama administration is doing by one, walking away from an existing program for poor families, and then two, using coercion tactics. This is the Sopranos. This is just another example of federal overreach. It's no different than his executive orders where he thinks he can dictate things instead of going through Congress. He shouldn't be able to coerce the state into expanding Obamacare by holding money back for low-income families.
Governor, I have a question about the Hospital Funding Commission. You're taking criticism in your home state for the fact that many of these people on the commission have no experience running a hospital, and the chairman of the commission has no hospital experience whatsoever. Some are even saying that it was political contributions that played a role in your determination that he should be on the board. What do you have to say about that?
If you think about healthcare impacts every family. Everybody has their experiences with the healthcare community. So what I've done, I've picked individuals that I believed would be objective, what I believe would help get more information. I think it's important that all of our citizens understand how the healthcare system works, and so that's how I picked the individuals I did. We need to look at why does healthcare cost what it costs? All of us need to know that access to healthcare is impacted by the cost of healthcare, and cost of healthcare continues to go up. I think a lot of that is caused by government programs. We also need to look at whether we need to continue to have certificate of need laws. Should we sell insurance across state lines? Why do some hospitals do so well? You look at our industry, $3.7 billion in profits. Why do some do so well? Some, with similar patients, do so poorly. So that's what I want to do. I want to educate the public and hopefully come up with ideas of how we can make a healthcare system that's more accountable for patients. And the right way of doing it is get people that are impacted by it all the time.
So the particular implication that it was a political contribution had you assigned Carlos Baroff to the chairmanship?
Of course not.
Governor, why are Democrats on your meeting schedule today?
Well, what do you think the chances they're going to help me? I mean, they're sitting there trying to expand. They want Obamacare expanded. They're not going to be helpful to me. I'm going to spend my time with individuals that I think have a chance of helping me. It's, again, This is the Obama administration cutting a program out for poor families.
Governor, if HHS says the proposal is just too big, why not work out a deal where you just reduce the size of the proposal so it doesn't cover people that would be covered by Medicaid expansion?
We have been talking to HHS for the last year. Okay, we can't get an answer out of them. So what they've done is their answer is no, and that's what they've messed up my budget session. I just had a regular session where we sat there and they couldn't make it. HHS wouldn't make a decision. We made plenty of proposals to them. Had lots of conversation with them, and they knew what was going on. They're sitting there, and what we all know is no answer is a no. So now I'm subject to we're going to have a special session. We'll have I believe what we're going to end up with is a base budget. We'll deal with the Amendment 1 as part of that, but we'll just continue the budget.
And just on the surplus question, could you just answer why not use surplus instead of going continuation?
The right thing to do is continue to get jobs in our state. That's going to help with our tax cuts. Right thing to do is continue to invest in our education system.
What kind of response are you getting from the Republicans you met with so far?
I think we need to continue to have some more meetings, but I think they're very supportive. I think they're all surprised, like I am. I think they're all disappointed that the federal government will continue to do this, especially when the Obama administration was told they can't be doing this under NFIB versus civilians.
Did you ask for any specific help from the delegation, or did they make any promises to you after this meeting?
What I've been asking for is I'd like them to consider putting out statements, making phone calls, writing letters. I'm appreciative that Chair Upton is going to hold hearings on this, because this is just the next step of federal overreach by the Obama administration on states' rights.
Was Upton at the meeting?
I met with him today.
Privately?
Yeah, privately.
Governor, I noticed Paul Clement, big name Supreme Court lawyer, is one of the lawyers on your case. Are you prepared or expecting this case to go that far?
I believe we're going to win. Paul Clement's got a great reputation. He was the lead lawyer in NFIB versus civilians. So he dealt with the same issue before. And so I think we got the right lawyer. We have a very good attorney general in our state, Pam Bondi. She's also part of this, and she'll do a great job. So we have a great team of lawyers, and I believe we're going to win. Yep. Unfortunately, the legal process takes a longer time. The HHS should have made a decision before session ended. Now they know that I have a special session starting June 1. They're still sitting there and still haven't made a decision.
Governor, last week when you were here, you mentioned that the federal government is free to run a program if they're willing to pay for it. Does that suggest when you did support expansion, you would have only supported through 2016 when there's a full match, or can you explain?
I was clear what I said 2 years ago. That I said the same thing when we had the conversation about high-speed rail back when I first came into office. If the federal government wants to run a program, they should run that program. Now, they shouldn't start a program that they're not going to continue to fund, and that's exactly what they're doing with LIP. But let's look at what's happened with Obamacare. It's caused healthcare costs to go up. We know it's going to cost our citizens $5 billion at least in taxes over the first 10 years. And if you look at the history of most healthcare programs, they cost multiples, way more than what they anticipated when people started them.
Last question.
Governor, why not just switch to Medicaid expansion? Some other Republican governors have done this, like Kasich. It would be perhaps easier. Why not do it that way?
Well, two things. First off, the low-income pool is a separate group of individuals than the Medicaid expansion and the expansion of Obamacare. That's one. Two, it's $5 billion. If you think about, look at what's happened in Florida. We have, last year, I think 250,000 people moved to the state. We'll have, I think, more than that this year. And why are people moving to the state? They like our sunshine. They like the fact that we have all these job openings. They like the fact that we've added 841,000 jobs. But they also like the fact that we have no income tax. We have a low business tax, and we keep our taxes low. We have the smallest state government per capita in the United States. That's what they come there for. And so it's the wrong thing to add another $5 billion in taxes on our citizens.
Thanks, everyone.
Thanks, everybody.
Are you in
Have a good
contact
day.
with the
Bye-bye.
State House and Senate leader?